Hello everyone, this is Dr. Anoop Singh. I have done my MBBS from Mysore Medical College and Research Institute, and today this video is all about the branch selection criteria. What all the things we have to consider in mind while choosing a particular branch. As you already know that NEET PG 2025 exam was held on 3rd of August. Result was announced on 19th and scorecard was released on 29th. So now the main uh, the main thing about branch selection is that the candidates are not able to figure out which are the branches they have to take. So this is a selection criteria or a selection guide to just guide you about the branch selection. First of all, we have to know that which branches we don't want. This is the main criteria which you have to look for. For example, अगर मुझे सर्जिकल ब्रांच पसंद नहीं है then already like MS ortho, MS opthal, MS ENT is out. So these are the branches which I won't think about. So these are the thing which you have to consider in your selection criteria. First you have to filter out which branches you don't like, and once they are out then you have to uh, just go for a provisional branch. For example, जैसे हम लोग case history लेते हैं, in that case first we will describe history, then examination, then we come to a probable diagnosis. We don't know what is the definitive diagnosis, but still we know that these are the things which can be there in the patient. Similarly, the branches you have to filter out and then you can proceed further. So there is a famous saying, scope branch में नहीं बंदे में होता है. This is was told by our beloved Dr. Gobind Rai Garg sir, pharma faculty in Cerebellum Academy. So this is a very good line and very deep. It has very deep meaning to it. So the potential of earning doesn't depend on the branch. This is not only the factor, but the earning potential lies in the individual. What is the business idea? Actually, frankly speaking, that once you are into private practice, the even if you are earning money, then it is just like a business. So बिजनेस आइडिया आपका कैसा होगा उस पर डिपेंड करता है, अदर स्किल्स पे डिपेंड करता है. इट ऑल्सो डिपेंड्स ऑन द कम्युनिकेशन स्किल्स ऑफ ए डॉक्टर. It depends on the how much patient and doctor relationship is, and trust of the patient is the ultimate thing which will decide your earning, not the branch. So let's see further. Now the first question is why branch matters. Why we are uh, why the students are very uh, much confused about the branch. So first thing is like that it is a second marriage. Okay, and you have to consider this branch as your lifeline and lifetime. For example, lifeline का मतलब ये होता है कि it will give you roti kapda and makan. That's why it's your lifeline. Lifetime means that this branch will be with you till you die. So that's why the selection is very important. Lifeline and lifetime इसी को हम बोलते हैं. The second thing is that work life balance versus money. You have to understand that the selection of a branch is not so easy. You have to consider your personality type also. For example, I want work life balance. I want that after 4 p.m. I should not get any call. I should fulfill my extra co-curricular activities. I should go and play badminton. I should go and play cricket. I should watch TV. I should watch Netflix. I should spend time with my family. So this can be the priority for individual A. So ultimately the individual A should take the work-life balance, the branches which provide work-life balance. But on the other hand, some type A personalities, they want money, they want fame, they want recognition. So the branches what they should take will be like MD general medicine, MD general surgery, and like that. So that the you have to be just classify yourself what you want, like you want money, work life balance, or you want money, and accordingly you have to take that branch. Now coming to training length, as we already know that surgical branches have long learning curve. What is the long learning curve? We will see in the next slide. The fourth thing is geographic angle. Some branches are there which is very good in rural areas. For example, MD general medicine, MD pediatrics. Okay, these are the branches which will boom like anything in tier 3, tier 2 cities. But uh, being a MS general surgeon is not enough in tier 1. You have to do your MCH also. So it depends on the geographical place where you will settle after completing your MD or MS. Okay. And the last thing is that you have become a doctor to be happy. This is the ultimate aim. Okay. I will give you a scenario that one of my friend, he did his MBBS, and after that he is a permanent medical officer in a PHC. And just around 3-4 days back I was talking to him, and I told him that यार तूने NEET PG exam लिखा कि नहीं लिखा. He told, yeah, see, the ultimate aim of my life is to being happy. I am just going and doing my duty from 8 a.m. to evening 4 p.m. and after that I am getting time to play my I am getting time to play my favorite sports, watch my favorite movie. So ultimately at the end of the day I am very happy. So the condition will be like that. Like some of us will be very happy being an MBBS, but some of us want that, no, I want to do MD, no, I want to do DM, no, I want to do fellowship. So this is the very it is a rat race only, frankly speaking, but the ultimate aim of our life is to being happy. Okay, so you have to consider this factor also. Being happiest is the topmost priority while choosing a branch. Now coming to learning curve, what I was mentioning in the previous slide. So here you can see the uh, ultimate aim is to become a good surgeon. In MS branches I am talking about. See the curve which is in green portion. Here if we consider x axis as number of years in the training and y axis as surgical skill acquired, so you can see the green curve. Here the first 3 years will be, we will consider residency. So as soon as the MBBS pass out joins the residency, so the surgical skill curve will increase, and once it crosses the frustration barrier, then the individual will come under zone of mediocrity. Okay, and after that there is another barrier which is known as passion barrier. If it continues and if he crosses the passion barrier, then he will become an expert surgeon. So this is a very important curve. For example, now if we consider the curve which is in red color, so this is the curve of a competent surgeon. What does the competent surgeon means? It means that what he has learned in his residency, same thing he will do forever. Same thing he want to do forever. For example, in case of MS Opthel, if he is able to do the cataract surgery well, and he learned the skills very diligently, very what you say, काफी अच्छे से उसने सीखा है, तो that if he maintains that, so he will be a competent surgeon. And similarly, if we see the curve C, which is in sky blue color, so if the surgeon starts practicing and if he is not able to cross the frustration barrier, the curve will go down. So automatically the dropout rate will come. Once he completes his MS, and after 1 or 2 years he will say that, no, I am not mean for doing surgery, ये मुझसे नहीं हो पाएगा. So ultimately what he will do, he will take a drop, or ultimately he will switch his career. So this is a very important curve, that MS branches demands a very long learning curve. Even after doing your MS, it's sometimes not even possible to learn the surgical skills at perfection. So that's why SRship is made. That's why SRship हम लोग तभी करते हैं, इसलिए करते हैं, because अगर हमने MD MS में ये सब नहीं सीखा है, तो SRship में हम ये अपनी स्किल डेवलप कर सकें. That's why this SRship and assistant professor and all is made. Okay. Now coming to first generation doctors versus second generation doctors. For second generation doctors, I want to say only this thing, that whatever branch your mother or father already, whatever clinic they already have, whatever is the setup, just if you are having any inclination, any interest in that branch, just take that branch, because opening a clinic in India and doing private practice is not so easy. So it's better that whatever branch your father or mother has done PG, same branch you have to you can take, and just you can skip that struggle phase of your life. Second thing is a very important thing of branch versus college. See, branch is like your wife. The branch will be with you forever till you die. But college is like your girlfriend. Okay, college will be there with you for 3 years. After that, nobody will ask you from where you have done your MD or MS. Nobody will ask you what was your marks in MD, what was your marks in MBBS. The ultimate uh, thing what matters is a degree. Coming to a degree, there are three degrees: MD, DNB, and diploma. As the general norm says, MD is better than DNB is better than diploma. But in some cases, the DNB is better than MD. Okay. For example, if you take Gangaram Hospital, okay, if you take uh, Gangaram Hospital, if we take an example, so the DNB is very good there, and it's located in the Delhi. It is a metro city. So DNB there, doing DNB there is far better than doing MD from a peripheral college. So you have to just figure it out. You have to see the previous year trends. You have to talk to the seniors who were working in that Gangaram hospital, and you have to make a decision. Okay. Now, as I have already told you that if you want to do a surgery, then you have to go for MS. If you want to do medicine, if you want to open a private practice, then it's better to do MD. And if you want a combination of the two, then you can do MD skin, MS ortho, or MS ophthalm. Okay. So now classification. Now I have classified the branches into three types. For example, if we consider uh, various broad specialty branches, it can be divided into three types, that is hot branches, warm branches, and cold branches. What is hot branches? Hot branches are the branches which is having high risk and high reward. Okay, but they are physically and mentally exhausting, and there is a need for super specialization, and recognition is there. Patient knows by your name. Patient नाम से आते हैं. Patient आपका नाम जान के आपकी OPD में आएंगे. Okay, then some of the branches are like warm branches, which is moderate risk, moderate reward. Okay, and there is a good decent work life balance in that branches. We will be dealing with the branches in the few slides. Okay, then some are cold branches, which is limited to teaching in medical colleges, mainly pre and some paraclinical branches. So coming to MD general medicine, which is definitely a hot branch. Let's consider some pros and cons of the branch. Pros is that it is an evergreen branch. Okay, like MD general medicine guy is a all rounder. He can treat many number of cases. That's why it's called an evergreen branch. But it has a high risk and high reward kind of thing. Like the risk is high, you have to study a lot. Nowadays, MD general medicine is not enough in tier 1 cities. You have to do DM. Okay, you have to do fellowships. Then only you can survive in tier 1 cities. And it has a broad clinical exposure, like you are an all-rounder. After that, it has a high demand across hospitals. Okay, like if you just make your resume, make your CV, and you are a MBBS and MD general medicine, and if you apply in tier 2 city or tier 3 city in corporate hospitals, then I can guarantee you that you will get a job. Okay, the salary won't be that great, but you will get a job, okay, easily. And if you don't want to do a job in a corporate hospital, setting up a OPD is very easy in this branch. Just you want a paper, pencil, one receptionist, or one what you tell, nurse, or any nursing assistant. Okay, then average salary in corporate will be around 3 to 3.5 lakhs per month. I am telling this salary immediately after doing your MD. Okay, and private practice, if you do, first of all, any branch, if you do private practice, money is not the limit. Okay, I am just assuming average figures in India, and just I am writing it as 2 lakhs per month. But MD general medicine people don't have any limit. Okay, sometimes they will earn up to 8 lakhs per month, sometimes they will earn 2 lakhs to 2.5 lakhs per month. It depends on the practice to practice, your locality, your patient interaction, how is the communication skills. Okay, now coming to MD General Medicine, as a what are the cons of that branch? As I have already mentioned, it is a hot branch, so of course the physically and mentally exhausting factor will come, and it has always high workload. You will be on toes. whether if you are doing a MD general medicine anywhere, whether it is a central institute, whether it is a periphery college or somewhere in northeast, like it has always have high workload. Okay, you will be on toes in OPDs, you will be managing IPDs, ICUs, emergencies, and it has a longer duty hours as compared to other branches. Okay, toxicity level, it actually depends on the college to college, but as a general toxicity level is there. Any branch, if the work is more in that college, toxicity level automatically comes. Okay, so there is no work life balance as it is a hot branch. Okay, so as a whole, it is a very good branch. And if you want to do DM in the future, if you want to do, then only my suggestion is then only you can choose this branch. Now coming to MD general surgery, first of all, uh, we will go for a pros, that is it is a satisfying branch. Okay, made for tier 2 and tier 3 cities, and it is a procedural and operative skills. Okay, and you have to do super specialization, like we have discussed about MD general medicine. Here also we have to do MCH. Okay, then earning depends on practice, the type of practice. In corporate, on an average salary, um, 5 to 6 lakhs per month. This is, I am telling, after super specialty. It is after you complete your MCH, then corporate can give you 5 to 6 lakhs per month, and private practice, as it has no limits. Okay, if you have your own setup, if you have a good license with anesthesiologist, whether and if you call him as a freelancer, then there is no limit. And you can like coming to cons, that is physically and mentally exhausting. Okay, as it is a surgical branch, so it has a long learning curve. 24 into 7, it is an emergency branch, and you will be on toes. You will be managing OPDs, IPDs, ICUs, and emergencies. Okay, toxicity level depends on the college to college, and there is no scope of MS general surgery in tier 1 city. You have to do MCH. Now coming to OBG. Okay, and it is a hot branch, evergreen branch. As I have mentioned, like general medicine is an evergreen branch, MS OBG is also an evergreen branch. It has a high demand everywhere, whether it is a tier 1, tier 2, tier 3, it has a high demand everywhere. Okay, since OBG has a high risk also. See, the if the branch is having high risk, the income will also be high. Okay, because high risk always involves emotion of the individual. Okay, so uh, if the individual has high emotional constraints, that's why the income will also depends on that branch. So for example, it's a government of India's favorite branch. Why I am calling so? Because see, the development of a country depends on the infant mortality rate. Okay, neonatal mortality rate. Now nowadays under 5 mortality rate. So if a country has less number of infant mortality rate, then automatically the country is progressing to development. So this branch has a responsibility, this branch takes a responsibility to decrease the infant mortality rate. So that's why I am calling it as government of India's favorite branch. Okay, now you can do, after completing your MS, you can do mix of OPD and surgery. Okay, and it is a evergreen branch, so it will be there in tier 1, tier 2, tier 3 cities, and there is no need of super specialization in this branch. Okay, you can do reproductive medicine and other infertility like super specialization, but as a general, there is no need of super specialization. Now earning, coming to earning, immediately after SRship, corporate we can give you around 3 to 4 lakhs per month, and the private practice has no limit. Now coming to cons, as it is a hot branch, so physically and mentally demanding. And this is a very funny con I have written on my own. There is always a cold war between, I don't know, most of the colleges they are having cold war between the departments, मतलब interdepartmental cold war keep on going. एंड इट इज ए हाई मेडिको लीगल रिस्क. ओके, नाउ इट इंडिया में क्या होता है कि अगर आप डॉक्टर बोलता है, गायनी बोलता है पेशेंट से कि इसकी तो नॉर्मल वेजिनल डिलीवरी करानी पड़ेगी, तो पेशेंट का नेक्स्ट सवाल होता है कि इसका सीजरिन क्यों नहीं कर रहे हो. और अगर डॉक्टर बोलता है कि सीजरिन करना है, तो पेशेंट बोलता है कि नॉर्मल डिलीवरी क्यों नहीं हो रही है. So like medical legal case is very high in this branch. Okay, like first one is as I was going to the statistics, first one is pediatrics and second one is this, which has the highest medical legal cases against doctors. So patients violence also is very high in this branch, and after during your residency you will be dealing with emergencies, OPDs, IPDs and HDUs. Now coming to MD pediatrics. Okay, this is also a evergreen branch. दुनिया में देखो दो चीज कभी कम नहीं होंगी, बच्चे पैदा होना कभी कम नहीं होंगे और फ्रैक्चर्स कभी कम नहीं होगा. ठीक है, तो एमडी पीडियाट्रिक्स और एमएस ऑर्थो एक ऐसी ब्रांच है, वो एवरग्रीन ब्रांच मानी जाएंगी. ठीक है, तो it has a high demand. Okay, because children are everywhere, whether it is a tier 1, tier 2, tier 3 cities, the demand will be there. And you can think like that, कोई भी अगर सेटअप करना है हॉस्पिटल का, तो there are 4 branches which is utmost essential to run a hospital. That is MD medicine, MS surgery, MD pediatrics and MS OBG. Okay, these are the 4 things which is the base of any hospital. So without this the hospital can't run. So MD pediatrics की डिमांड एवरीवेयर हर जगह पे होगी, whether it is a corporate, whether it is a private practice, whether it is a national health mission, everywhere their demand is more. Okay, and as I have already mentioned, it is India's favorite branch because the ultimate aim is to reduce the infant mortality rate. Easy OPD setup, like MD general medicine, just you need a pen, paper, a receptionist and a compounder with you to run this to run this branch as a OPD practice. So it has a high income in tier 2, tier 3 cities. Okay, patient trust is very important in this branch. Okay, the communication skills, how let's see, many of the childrens don't require active management generally, I am speaking, because the parents are so worried about their children, they just need reassurance, and reassurance will be depend on you, how you convince the patient's relatives, patient's parents. Okay, if you are able to convince them, if you able to give your message to the parents, then it is a very good branch for you. So communication skills are very important in this branch, or this branch is best for private practice in tier 3 cities, as number of doctors in tier 3 cities are also comparatively less as compared to tier 1. Okay, now coming to cons. See, this is the branch which has the highest violence against doctors. Okay, second one is OBG, first one is this pediatrics. So uh, physically and mentally it's very demanding, because medical legal cases are more, so mentally it is very demanding branch. Okay, and there is very high cutthroat competition in tier 1 and tier 2 cities. I am not telling saturation, because I this is my personal opinion, because there is this is my personal opinion, there is no such word like a saturation. Yeah, yes, high competition can be there, but saturation word doesn't exist for me. So uh, as compared to other branches, this is a very good branch with high competition, but the satisfaction is more. Okay, and there is no work life balance, because as you know this is a hot branch. Okay, in private practice availability is required 24 into 7. Like I have talked to many of my seniors who are uh, who did their MD from my same college, and now they are 6 years of practice. So the feedback what I got from them are that pediatric जो branch है, like it requires 24/7 availability. Like मॉर्निंग में क्या होगा कि मॉर्निंग में आपको आपने ओपीडी देखी, आपने मेडिसिन प्रिस्क्राइब किया, उसके बाद patient will be having some doubt in the night, midnight or early morning. So you have to be physically and mentally available for them every time. Okay, because they are very worry about they worry a lot about their children. Okay, so it is a very demanding branch. So earning potential after SR ship corporate will give you around 1.5 to 2 lakhs per month, and private practice there is no limit. Now coming to MD radio diagnosis, this is the toppers branch. What trend we are seeing in the previous 7-8 years. Okay, so pros is excellent work life balance. The demand is very high among corporate hospitals because it is a procedural branch. Just remember that any procedural branch will be having high demand, will be having good absorbability of the doctors in the corporates, because it is income generating branch for the hospitals. Okay, तो उसमें क्या होगा कि जितना आप प्रोसीजर करेंगे उसका अलग से चार्ज करेंगे ये लोग. तो दैट्स वाई इट इज अ वेरी गुड ऑप्शन फॉर कॉर्पोरेट हॉस्पिटल्स टू अर्न मनी. एज वी ऑलरेडी नो दैट कॉर्पोरेट हॉस्पिटल का एम होता है प्रॉफिट प्रॉफिट प्रॉफिट. ओके, सो अगर कोई प्रोसीजर करता है तो उसका क्या होगा, इनकम जनरेट होगा. ठीक है, रेवेन्यू जनरेट होगा. दैट्स वाई दे आर ऑलरेडी इन हाई डिमांड. ओके, देन initially we will be having very good income. And radio diagnosis people are known as doctor का doctor. Okay, like you will be mainly जो diagnosis होता है mainly MD radio diagnosis ही करता है. and वो अलग बात है, नीचे clinically correlate लिख देते हैं, लेकिन the radio people are known as doctor का doctor. Okay, and less patient contact, it can be a pro for few people. Okay, and the violence is very less in this branch. Now coming to cons, it is a hospital dependent branch. Like opening a diagnostic center, private diagnostic center is very difficult. Loan लेना पड़ता है. You have to take the loan. You have to. There are prescribed guidelines. What should be the area where you have to open. Okay. Uh, it is also known as doctor dependent branch, because doctors will be referring some scan to you, and you will be doing that scan. Auto मतलब आपको market में patients नहीं मिलेंगे. Some your friends or some seniors will be referring the cases to you for scan. Okay, there is no recognition in this branch, because you are not in direct contact with the patient, so there is no recognition. Patient don't know you by name. Okay, after that there is a ceiling limit in earning. Okay, after few years there is a ceiling limit, which is unlikely in MD, general medicine, or other clinical branches. And telemedicine diagnosis is also possible. For example, I have a setup here. Okay, I don't have any radio diagnosis people with me. I will just, my compounder will do, just the technician will do the scan, and after that for reporting I will be sending my this one, my scan to any other doctor which is sitting, who is sitting in Delhi. Okay, from there I can consult him, and then he can send me the report. So earning, starting earning, I'm telling, it is in corporate, it is in and around 2.5 to 3 lakhs per month. Now coming to MD anesthesiology, it is also known as warm branch. Okay, pros of the branch is that it is an evergreen branch, because any surgical procedure you do, anything you do, you need an anesthesiologist, like as of today. ठीक है, you have to do anesthesiologist. उसके बाद क्या है कि this branch has predictable, flexible, and shift working hours. Okay, it has excellent job opportunities. Plenty of jobs are available in government hospitals, in corporate hospitals. Okay, in private nursing homes. Nowadays my seniors are doing freelancing. Okay, suppose some patient is being operated in XYZ hospital. Just on call they will call an anesthesiologist. The surgery will be done, and whatever the payment is fixed for an anesthesiologist, they will give you, and now he can walk away. So like that, like that, many of the hospitals are practicing. Okay, and now you can after anesthesia, if you don't want to join a hospital, uh, you can start a pain clinic. This is the clinic which are getting prevalent in tier 1 cities. Okay, now coming to cons of the branch, less recognition. Okay, the although they are actively involved in surgery, they are actively monitoring the patient during the surgery, but the recognition is less. Okay, doctor hospital dependent branch, as I have already told, that many of the anesthesiologists works in the hospital. This is not an OPD branch, and there is high stress during critical events. Even though you have shifts, but the shift is very important. Like it is a do or die situation. So that shift, for example, 8 hours ki shift hai, it will be very hectic for you. You will be having shift, but that shift will be very hectic. Okay, you will be on toes. You have, because ICU manage karte hain most of the anesthesiologists, and ICU manage karna is not an easy job. You have to monitor each and every patient because they are critically injured, critically, वो critical patients होते हैं. तो your uh, your commitment level is increased in that. Okay, and as I have already told, this is not an OPD branch. Now coming to MD dermatology. Okay, the pros of the branch is that it is an easy OPD setup. Okay, just you need a pen and paper. Predictable fixed working hours. Most of them work in corporate hospitals during the some fixed hour. For example, 10 morning में बैठते हैं वो लोग 10 a.m. to 1 p.m. and evening they shift they sit 4 p.m. to 6 p.m. like that. So it is a high income branch because procedures are involved in this branch. So it is a high income branch. It provides a good work life balance. Now derma clinics are just booming in tier 1 cities because everyone wants to be young. Nobody wants to be nobody wants wrinkles in their on their face. Okay, so derma is a new future. Okay, then you can do both OPD and surgery in this branch. Okay, you can practice dermatology as OPD branch, and you can go for surgery also. For example, you can go for hair transplantation. You can go for botox. You can go for laser therapy. So many new things are coming up in this branch. So it is a potential branch. Now coming to earning, corporate can give you a average of 2.5 to 3 lakhs per month, and private practice has no limits. Now coming to con of the branch, there is a high competition in this branch. For example, now like 1 or 2 months back, I was just going through a newspaper, Times of India. In that, it was written that there is a in UP called Kanpur. Okay, there a dentist was practicing hair transplantation, and after that, some complication happened. One engineer came from Bangalore for hair transplantation. Some complications happened, and that patient died. So many of them are doing such practice in many cities. Even beauticians, they are going through a certificate course like aesthetic course, and they are practicing lasers. Okay, so that's why competitions are high in this branch. Okay, there is high investment needed for private practice because new lasers are coming up. The lasers are very costly, so high investment is needed. And this branch is not for tier 3 branch, the tier 3 cities. Okay, and there is less recognition. Okay, and there is overlap with general medicine because rheumatology cases, most of them will be having skin manifestations. So there will be overlap between this branch and general medicine. Now coming to psychiatry. Okay, it is a warm branch. It is a very easy OPD setup. Okay, potential branch like MD radio. जो MD रेडियो का हाल था 20 साल पहले, वो ही साइकेट्री का हाल है अभी. एंड नाउ एमडी रेडियो में जो जो नीट पीजी का काउंसलिंग देखेंगे आप, एमडी रेडियो अभी टॉप पे जाती है. एमडी साइकेट्री का सेम चीज होने वाला है 2040s में. आप देखना एमडी साइकेट्री विल बी द टॉप ब्रांच because see, now the addiction is not limited to alcohol, smoking, drugs. It is also related to mobiles. ठीक है, लैपटॉप्स, टैबलेट्स, उसमें भी हमको अभी डी एडिक्शन की जरूरत है. एंड लाइक मेनी ऑफ अस विल बी लाइक एवरी वन ऑफ अस विल बी हैविंग मोबाइल. ओके, हमारी फ्री टाइम में हम लोग क्या करते हैं, मोबाइल में लगे रहते हैं. सो दिस ब्रांच इज a high potential branch. Okay, because mental stress is increasing day by day. Jobs are very scarce. Okay, these years ज्यादा पढ़ाई करने के बाद हमको जॉब नहीं मिल रही है. ओके, our expectations are high, but we are not getting what we expect. Okay, so it is a high earning potential in late 2030s, and this branch is irreplaceable with AI. I'm telling you because this branch involves human emotion. So this branch is irreplaceable with AI. Excellent work life balance है इसमें. Highest practice in tier 1 cities. Like for one patient, my senior is doing he has like 5 years उसको हो गया है practice के लिए, and he is practicing in Mumbai. And one patient he is charging rupees 3000. Okay, because OPD practice is huge in this way because interaction is more, because diagnosis जो भी होती है आपकी history के base पे होती है. So you have to interact with each patient at least 20 to 25 minutes at least, I am telling. So similar same thing, that's why the fees are more in this branch. Cons is that stigma which is decreasing day by day. Okay, high dropout rates. There is a entity known as second year syndrome. In this syndrome, every resident in his second year thinks that whatever branch I have taken, it is not meant for me. Okay, this is known as second year syndrome. Same thing happens with the psychiatric resident. In the second year, in the start of the second year, they will think that जो मैंने लिया है बहुत बड़ी गलती की है. And this branch has less scope in tier 3 cities. Okay, I have not mentioned is nil scope. I have mentioned less scope in tier 3 cities. Okay, now coming to MS orthopedics, which is a hot branch according to me. So Prawns is that is the evergreen branch. High demand among all tiers of cities because accidents will keep on happening, and high income. Okay, it is a satisfying branch. Respect and recognition is there in this branch, and there is no need for super specialization in this branch. But you can do fellowship, but there is no need for super specialization. Super specialization is available in this after completing MS Ortho, like in upper limb surgeries, it is there, spine surgeries, it is there. But you can most of them prefer fellowships in this branch. Cons is that it is physically and mentally demanding. There is no work-life balance. There is high competition because diploma are available. Uh, if diploma is available in any branch, the competition is high. ठीक है, जिस जिस branch में diploma available होगा, competition ज़्यादा होगा उस branch में. 24/7 emergencies आती हैं. Toxicity is there, depends on college to college, and need for fellowship in tier 1 cities. There is a need for fellowship in tier 1 cities because tier 1 cities में you can't survive after completing MS Ortho. You need to do fellowships. Now coming to MS Hostel, which is which is my favorite branch. This is a warm branch. Excellent work-life balance, less emergencies, decent income, surgery less exhausting and quick, and okay. And earnings depends on an average. It is 1.5 to 2 lakhs per month in corporate and private practice. There is no limit. Cons is that it is high competition in because diploma is available. Okay, so the high competition is a problem in this branch. I am not telling about saturation. I am telling about high competition. High investment is required because if you want to set up your ophthal clinic, independent ophthal clinic, you at minimum you require at least 1 crore to, because you have to buy many instruments and the ophthal instruments are not so cheap. It is very costly. Okay, and as I has explained earlier, it is a long learning curve. You have to continue to do your learning because after MS Opthal, many of them don't get confidence. You have to do fellowship after this branch. And nowadays, what is happening is that, for example, if a cataract surgery is concerned, medical camps are organized by Government of India, and many of the rural people are getting operated in that camp. So what happens that initially what happened, पहले क्या होता था कि they just migrate to urban area, get their cataract surgery done from a hospital and go back to their villages. Now government of India are reaching rural India, and they are organizing medical camps. Cataract surgery वहाँ पे होता है, and now they are all get treated by that camps free of cost. So cataract cases are now decreasing in tier 1 cities. Okay, and fellowship is must in this branch also, like MS Ortho, and microsurgical skill is required. Okay, I am just mentioning this because if you have tremors, okay, if you are having anxiety, it is not a good option to opt this branch because this requires microsurgical skills. Incisions are very small. You have to be very precise. Okay, in this branch, that's why microsurgical skills are required. That's why learning curve is more. जहाँ पे माइक्रो सर्जरी होगा वहाँ पे लर्निंग कर्व ऑटोमेटिकली ज़्यादा होगा because that skill require many years of practice to get that skill. Okay. Now coming to MSENT, which is a warm branch again. Okay, pros is that you can do OPD practice as well as surgical practice as per your requirement, convenient. Okay, endoscopic and surgery is the prevalent in this ENT branch, and good private practice potential. Okay, if you are a good ENT specialist, people from far away will come to you. Okay, earning potential 1.5 to 2 lakhs per month, and private practice has no limit. Cons is that opthal, this branch also has some microsurgical procedures which require a long learning curve, and now you have to do MCH head and neck surgery after MSENT, and high investment for OPD practice as usual. And this branch has overlap with OMF. OMF means oromaxillofacial. Okay, so उसमें कुछ ओवरलैप होता है. दिस इज ऑल्सो ए कॉन इन दिस ब्रांच बिकॉज after completing MD, BDS, MDS, there is a course called MDS in OMF. Okay, that OMF overlaps with this ENT branch, so it can be a con. You can consider it as a con. Now coming to MD Community Medicine, which I consider as a cold branch. Pros of this branch is that they are the policy makers. They are the king of national health mission programs. Okay, they are the king. As it is a cold branch, very good work-life balance. Patient interaction are there because they are doing many outreach programs. They are going to the villages. They are talking to the villagers there, and they are getting the feedback what the people of that community thinks. So interaction is more in this branch. Okay, so if interaction is more, communication skills are more, then you can sustain any branch. So you can do a mix of OPD practice and teaching career. Okay, WHO jobs are available. Okay, many vacancies are available in medical colleges. You can apply for that. Okay, cons is that limited income. Private practice is limited to MBBS level. Okay, so the meaning of the last point is that suppose if you are doing any MD in preclinical or paraclinical subject, you can practice as an MBBS ना यार. Okay, like many of my juniors are telling me that sir मेरे को तो प्री क्लिनिकल मिल गया, अब तो मैं प्रैक्टिस कैसे कर पाऊंगा. भाई, you are an MBBS doctor यार. You are an MBBS doctor. Just you have to open your clinic. Patient flow will increase. मतलब पहले साल में कोई नहीं आएगा. आई अंडरस्टैंड दैट 3-4 months इज द इनिशियल बैरियर विच आप कुछ भी कर लेते हो कि 3-4 आप क्लिनिक डालते हो अपने, तो 3-4 months में पेशेंट नहीं आते हैं. Once that 3-4 months or 6 months or 1 year will pass, then patient's flow will increase. ओके, तो आपने पीजी किस में भी की हो, whether it is MD community medicine, MD physio or MD anatomy, MD biochemistry, you are an already an MBBS यार. You are authorized. You are you are authorized to treat patients. Okay, so don't think that you have taken MD anatomy then you can't treat patients. You are an MBBS यार. You can still do private practice. Okay. So coming to MD pathology, okay, this is a warm branch according to me. This is also an evergreen branch because every branch needs an investigations. Okay, whether it's a biopsy, whether it's a hemat oncology, every branch demands pathology. Okay, कोई भी सर्जरी होती है तो उससे पहले हमको hemoglobin percentage चाहिए होता है to know the blood status level. Okay, it is a best paraclinical branch among all. Okay, high income potential, no emergencies, very decent work-life balance, corporate, as it's a procedural branch, so corporate gives almost 2 to 2.5 lakhs per month, and private practice, if you have a private lab, there is no limit. See the image on the right side, imaging and path lab. Okay, this nowadays what is happening that they are opening a joint venture. Okay, for example, मेरा कोई दोस्त अगर पैथो है, ठीक है, माइक्रो है, और पैथो है, माइक्रो है और रेडियो है. So together we will invest, we will buy one land, we will construct a building, and ग्राउंड फ्लोर पे मैं अपना पैथ बना लूंगा, सेकंड फ्लोर पे तू अपना रेडियो खोल लेना, और थर्ड फ्लोर पे हम माइक्रो खोल लेंगे. नाउ द जॉइंट वेंचर थिंग इज कमिंग अप. Okay, because all three branches, path, micro and radio, are diagnostic branches. Okay, so in one roof, many of my friends do partnership and open. Okay, so this culture is coming up day by day in tier 1 cities. Now coming to cons, there is no patient interaction, minimal patient interaction, and high dependency on other branches, other doctors. High investment is required to open the private labs, and high competition is there. Recognition is less, like MD radio. Okay, and this can be a con. AI replaceable. Okay, because starting में क्या होता था, when I was an MBBS student, then that time no, my professor used to look in the microscope and count the number of WBC, RBC or platelets. After that, what happened? Semi auto analyzer came, hemat analyzer, biochem analyzer. Everything now became machine dependent. So this is the branch which can be AI replaceable. Okay. Now coming to MD Micro, very decent work-life balance, high value in corporate practice. Okay. Joint venture, like I have already mentioned, patho plus micro plus radio. They can join together. They can do the partnership and open joint venture. उसके बाद excellent scope in tier 1 cities. And after completing your MD micro, you can do DM in infectious diseases, which was uh, uh, very important branch, which कोविड 19 पैंडेमिक में बहुत यूज हुआ था इस ब्रांच का. And earning potential depends on the corporate, depends on the corporate, whether you are in corporate or whether you are in private practice. Corporate can give you a salary of 1.3 to 1.5 lakhs per month. Now coming to cons of this branch, that is limited income, high dependency, as other diagnostic branches, high dependency on other branches, other doctors, and this branch is not for tier 2 and tier 3 cities. Now coming to MD forensic medicine and toxicology, I am in this video, I am mentioning about other branches also, because there are few branches like aerospace medicine, sports medicine, geriatric medicine, jahan pe there are very few videos given, very few videos are given on YouTube. Okay, but you should know about this branch. What is that branch? What is the pros and cons of this branch? Because these are upcoming branches. So coming to MD forensic medicine and toxicology, see, this point number one is very funny. There is no live patient, so least medical legal cases against doctor. Patient ही जिंदा नहीं है तो तुम पे केस कौन करेगा? ठीक है. So this is one of the you can consider it as a pro. After that, respected specialty. You will be called in court as an expert witness, and you will be called as an autopsy specialist. Okay. So good interaction with local police and lawyers. इनमें इसमें क्या होता है कि इंटरेक्शन बहुत अच्छा बन जाता है लोकल पुलिस एंड लॉयर्स से. And interesting and peculiar cases you have to you can see with your eyes. Interesting and peculiar cases, mysterious cases you can see. And there is fixed income limited to medical colleges. Like any branch, if you join medical colleges, they will pay you as per pay scale, government pay scale, जो 7 पे कमीशन का जो भी होता है उसके अकॉर्डिंग ही आपको इनकम मिलती है. Now coming to cons, after interacting with my senior, this is the four things which he told me. Pressure from ministers. Sometimes क्या होता है कि cases इतने complicated होते हैं, इतने media attention बहुत होता है कि pressure आता है, undue pressure from ministers or police, which is totally unethical. Okay, and there is strong and emotionally stable doctors are required for this branch. Okay, there is no patient interaction or private practice. You can't do private practice in this branch. Okay, and there is limited salary limited to medical colleges. Now coming to MD Pharma, like uh, uh, pro of this branch is that studies and research are the biggest pro of this branch, because every medicine, like for हम लोग क्या कर पढ़ते थे, जैसे first generation, second generation, antihistaminic, third generation, fourth generation ऐसे पढ़ते थे. So the research is always on in this branch. Okay, and pharma companies nowadays, pharma companies are coming up like 1mg, Sun Pharma, Cipla, जो भी हो. ठीक है, तो इसमें क्या होता है कि they are hiring the doctor as a research head. Okay, for research they are hiring doctors. So after completing MD Pharma, you can join that pharma company and you can progress your career. And you can do private practice as a MBBS, that is general physician. You can do anywhere. Okay, because you have in-depth knowledge about medicine. You know how it affects, what is the mechanism of action, what is the adverse effect of that medicine, how to tackle that adverse effect. You very well know that in detail. So you can do a private practice very easily as compared to other branches. And they are involved in pharmacological trials, very good work-life balance, and fixed income in medical colleges. If you are appointed as a assistant professor or associate, you will get the pay as per pay scale. Now coming to cons, extensive traveling in pharma companies. Okay, for example, after completing your MD, if you join any pharma company, you will be keep on traveling long distance. कभी city में जा रहे हो, कभी उस city में जा रहे हो. That's the main con of this branch. Okay, the fixed income is there, less satisfaction to treat patient. Okay, and there is no recognition in this branch apart from teaching. Okay. Now coming to MD radiation oncology, it is a very good branch, cool branch, good work-life balance. The feeling of satisfaction is the most biggest pro of this branch. Okay, a very good doctor-patient relationship is required in this branch. Even if you know that your patient won't survive 6 months, the how you communicate with the relatives is very important in this branch. and there is a high salary in corporates. Okay, recognition is there in this branch. If you treat even one patient, the entire village will know your name. Okay, सो मेरे घर पे क्या था, मेरे नानी के घर पे एक मेरे मामा थे, उनकी वाइफ को हुआ था एक कैंसर। तो उन्होंने रेडिएशन ऑन्कोलॉजी का दिखाया कि पूरा, उसके बाद क्या हुआ कि पूरा गांव, होल विलेज नो द डॉक्टर बाय हिज नेम। एंड कुछ भी होता था तो दे go to that hospital only where the doctor sits. Okay, this is the amount of recognition this branch will give you. Now coming to a con, you can't open your private clinic in this. It is a hospital dependent branch because it requires Linux. Okay, Linux machine required होती है इसमें। उसके बाद high burnout rate because death will be happening in this branch. So the sometimes what the resident will think that okay, मतलब I am not able to save my patient. What's the use of being myself as a doctor? So the burnout rate is okay. No independent OPD practices is you can do in this branch, and this branch is most famous in Tier 1 cities only because corporate hospitals are located mostly in the Tier 1 cities. Okay, saturation is more because corporate hospitals are less. Already they have MD radiation oncologist available, DNP radiation oncologist available, so replacing them is very difficult by the young radiation oncologist passing pass outs. Okay, that's why saturation level is little bit more in this branch. Now coming to MD geriatric medicine, that is a very good branch, upcoming branch. Okay, I consider it as a warm branch. Okay, because already geriatric medicine pass outs are very less, so as of now very less competition. Okay, there is less struggle in climbing medical college faculty ladder. What is medical college faculty ladder? With after completing your MD you will become SR, after that assistant, then associate, then additional, then HOD, like that. Okay, since geriatric medicine pass outs are very less, so it's very easy to pass that struggle. Okay, easy OPD setup. As general medicine, you require just a table, chair, receptionist, and a assistant. Broad spectrum of clinical cases you can see. This branch has overlap with MD general medicine, psychiatry, okay, and dermatology, because psychiatric issues are more common in old age. Okay, geriatric people are more prone for hypertension, diabetes. Okay, as everyone knows that India is a diabetic capital, so these cases are very prevalent. Okay, corporate will give you 2 to 2.5 lakhs per a month, and there is no limit in private practice. Now, just I want you guys to see these two graphs. The graph which is located in the left side is India in 2025, this year, and the graph which is located on the right side is India in 2050. Now just look at this, 60 and above. These are the population who are 60 and above at this time, at presently. So 1.4 plus 1, 2.4 plus 0.63, approximately 3.5. Okay. Now consider this graph, 60 and above. Okay. This is India in 2050. 3 plus 2.5, 5.5, 7.5 plus 1.3, like 8.8. So it is, this comes around 9%. Okay, so see, today 60 plus population is 3%, and in 2050 it will become 9%. Okay, 9% of India's population is huge number. ठीक है, अब 9% individual 2050 में 9% will be above 60. So the demand of geriatricians will increase in 2050. That's why I already mentioned it as an upcoming branch. Okay, first of all, the demand supply ratio has the huge gap. Okay, demand उसकी ज़्यादा होगी 2050 में, supply will be okay. So the gap is more. If the demand supply gap is more, the more earning potential of a doctor. Okay, so this branch is an upcoming branch. The effect will be seen after 2050. Okay, now coming to cons of this branch. Awareness about public, like it is less, very less nowadays. It will increase as the year progress. and limited vacancies in medical colleges, mostly occupied by general medicine people. For example, HOD in most of the medical colleges where geriatric medicine branch is available, they are MD general medicine. Okay, so and this can be considered as a cone. This branch has overlap with other specialty like if suppose if 60 plus comes with a stroke, it can be seen with he can be seen in medicine OPD. If there is some issue with memory, he can be shown to psychiatrist also. So there is a very broad overlap of this branch with other branches. Now coming to MD sports medicine, another cold branch, high earning potential, because as you know that 2008 से हमारा IPL start हुआ था. So every IPL team has a sports medicine available, sport medicine trained physicians available. Okay, so if you combine sport, if you open your own clinic as a sports medicine, and if you combine, if you have your friend as a PMR, physical medicine rehab, then it is a deadly combo. Okay, so ये मतलब आग में दही, आग में सॉरी दही बोल रहा हूँ, आग में घी डालने जैसा है कि स्पोर्ट्स मेडिसिन और पीएमआर अगर दोनों ने एक साथ क्लिनिक खोल लिया तो इट विल बूम लाइक एनीथिंग. Okay, and it has an excellent work life balance, less struggle because MD sports medicine uh, uh, vacancies are very much mostly occupied by orthopedicians as of now, but as the year progresses, it will get occupied with sports medicine pass outs. Decent salaries available. Okay, private sports medicine doctor जैसे मैंने पहले बताया, every particular whether it's a hockey team, football team, badminton team, kabaddi team, they have the sports medicine trained physicians available with them. Okay, now see the right side picture. This is the sports injury center which is in Safdarjung Hospital VMMC. See, now it is now these kind of sports injury centers are taking prevalence in India because sports पहले हमारे country में इतना ज़्यादा नहीं बोलते थे, इतना ज़्यादा बढ़ावा नहीं देते थे. But nowadays sports are given priority in our country. So if the sports are given priority, so the need of sports medicine specialists will increase. So this is the example. Now with Delhi में खोला है sports injury center. Now other sports injury centers are coming up in metros. Okay, gradually it will come, but it will come. So sports medicine, since the demand is high and supply is less, so the potential of a doctor to earn money will increase in this branch. So coming to cons, sometimes few cases of sports medicine can be seen by orthopedicians also. Okay, there is a very big overlap with orthopedics. HOD vacancy in mostly occupied by senior orthopedicians. Unstable salary because suppose Indian cricket team goes and play in England, so that time a sports medicine physician will go with them. And suppose there are no matches planned in the next 3 months, so sports medicine trained physicians will be free in that time, so there will be less earning. So it depends, unstable salary is there. So no vacancy in government medical colleges of now because most of the because it is a new branch, so the sports medicine department is under progress in many of the colleges. Now coming to MD aerospace medicine, it is also known as gold branch. There is no patient interaction, least medical legal cases, high salary at senior post, good scope in armed forces, ISRO, NASA and civil aviation. For example, the right side you can see Dr. PK Verma. He is a principal consultant aviation medicine at IGI Airport, New Delhi. Okay, he is a MD aerospace medicine specialist. So at this level, at this seniority level, you can get a very decent salary with this branch. Okay, the cons is that still least vacancies. The vacancies are very few because airports are less, so vacancies are very less. Okay, less satisfying because you are not interacting with the patients because you are just doing the medicals of the pilots and their health. So the satisfaction level is a little bit less in this branch, and they focus on man machine integration. That is, man is the pilot and machine is the aircraft. So they are they focus on man machine integration rather than doctor patient integration. So as compared to other branches, these branches can be less satisfying for few of them. Now coming to non-clinical branches, uh, see, many of them are we can consider it as a cold branch because uh, there is a very good work-life balance in this branch. Okay, pros of that branch is that you can spend more time with your family. If you are just a family-oriented person, you can spend more time with your family with this branch. Time for second career, like you can just part time you can do some other job with this. Actually, this is a very big pro, because some of few of us are kya hai कि we are not made for one type of job. We want to do some other kind of job. That's why uh, this branch is very good for those people who want to go for second career as a part-time career. Okay, then decent income as per pay scale, because the medical colleges, they pay you according to the seventh pay commission, whether it's a state or a central. So the salary is fixed if you join a government medical college. And excellent branches for those interested in teaching. Those who are having interest in teaching, these branches are very good for them. Okay, and as I have already told you that any branch you take, you are already an MBBS doctor, so you can practice as an MBBS graduate in anywhere in India. So this branch also you can practice in tier 2 tier 3 cities. Now coming to cons, competition in medical colleges for non-medicals for teaching posts are increasing. For example, the NMC, अभी NMC का एक नया rule आया था, new rule has come where non-medicals can also teach anatomy, physio, and biochem to medical students, because they are MSc physio, MSc biochem, or PhD biochem, like that. So the competition is more, and the private medical colleges can hire them at a cheaper rate as compared to doctors. So they are preferring them. That's why it is one of the biggest con of these branches. And there is no patient interaction. Okay, and those who like clinical exposure, patient dealing, for them it can be less satisfying branch. Okay, and the money is not poor, but it is a very less as compared to other branches. And suppose if you are joining as a faculty in government medical colleges, then salary will be equal. But if you are in a private thing, or you are joining as a professor in a private medical college, then salary as compared to clinical branches will be less. So this is the another con of this branch. So that's all for today. Just I want to give a disclaimer before ending this video. Whatever I have told in this video is as per my personal this is my personal opinion. Um, if anyone wants to add anything about any branch, you can comment anytime. I won't feel sad. I won't feel bad. Okay, if you criticize me, also I won't feel bad. But the purpose of making this video is that you have some clarity how to go about it. Okay, because many mid rankers after NEET PG 2025, for example, between 10,000 to 20,000, they are extremely confused because they wanted MD Dharma or MD MS Ortho, but now they are getting DNB Medicine, DNB Pediatrics, or MD Anesthesia in Periphery College, like that. So, as I have already mentioned, that branch is always better than the city or the college. Okay, the ultimately what will come with you is the branch, not the city. So branch always takes precedence over the college, but these are the few pros and cons of what I have collected from my seniors. Okay, from my juniors or my super seniors who are already into practice after 7 to 8 years. Okay, so these are the brief summary of every branch. Okay, so you can comment below whatever you feel like any branch. If you want to add something uh, about a particular branch, if you want to dedicate sorry, if you want to delete something, whatever I have mentioned in this branch, okay, so you can just comment below, and whatever queries you want to ask me, you can comment below. I will try to answer. Thank you. All the best for the upcoming council. Supreme Court. Uh, don't know what when will counseling will start, but before counseling starts, you should know which branch you will be taking. Okay. All the best. Once again from my side. All the best. Namaskar. Good day.